Good afternoon, everyone. Once again joined by Catherine Morgan-Wicks and Dr. Veitch. Look, I'll start by giving what I think is probably the update that most people have been most interested in, and that is that over the last 24 hours we conducted 1,643 laboratory tests, and they have all been returned negative. Now, obviously we'll see an increase in testing again today, and we need to remain vigilant as we work our way through this. And importantly, I want to start by saying that, in terms of what's occurring across the country, we know that this strain moves with people, and obviously across the country it is causing challenges. We've currently got our restrictions in place with all of Victoria, all of New South Wales, 11 local government areas in Queensland, in addition to high-risk premises in Victoria, Queensland, Western Australia and Cairns. New South Wales, as you'd be aware today, recorded 291 new cases. There were 10 in Queensland and 4 in Victoria. Now, this is serious. As I've said, Delta is a game changer. It's more virulent, more unpredictable, twice as contagious. Now, over the last couple of weeks, we've said that it was a matter of when, not if. We'd have a case here in Tasmania, and yesterday that was confirmed with our first positive case in quarantine. And I want to make the point again that this was picked up in quarantine, not a case of community transmission. Overnight, workers continued on contacting people who may have come into contact with the man who, as I said yesterday, since left the state and is now in New South Wales. Our contact tracing teams have identified around 200 people to be assessed and managed, including around 100 that were on the Melbourne to Launceston flight that travelled into the state on the 2nd of August. In terms of testing and the work that's underway, Dr. Veitch can provide more detail in a moment, but I'm advised that those occupants of the hotel on the same floor, the man have also been tested and have returned negative tests. And in terms of the quarantine hotel employees, I'd make the point, in terms of the protocols that are wrapped around them, they are already having a daily saliva test and also a PCR test weekly. All have tested negative to this point, and in terms of vaccination for this group, I'd make the point that they are in the 1A priority group, and I understand that more than 90% of the employees at the hotel have already had their vaccination. Just in terms of staff across the public sector, we currently have 8 workers from health, 12 from Tasmania Police and 10 biosecurity staff that are currently in isolation at the moment. My understanding is that in the main they have all been vaccinated. Just a couple of questions in terms of a couple of the biosecurity staff to work through. Importantly, all of the contacts that we've been in touch with are being required to undertake testing, and depending on the circumstances, and risk assessment may be required for up to 14 days from the time of their contact with the case. Yesterday, as I've said, there were 1,643 lab tests conducted, and pleasingly all negative. We'll continue to keep the community informed as the remaining tests return over the weekend, and we'll be providing an update each day of over the course of the weekend, tomorrow morning and on Sunday morning. I want to touch quickly on the vaccine program. It's going well. Early this week we reached that major milestone of 50% of eligible Tasmanians having now received their first dose of the vaccine. However, obviously we need to encourage as many eligible Tasmanians as possible to ensure they safeguard themselves against the virus, and so don't wait, vaccinate. That's been our message now consistently. Importantly as well, I'm pleased that we'll see pharmacies joining the Tasmanian rollout. I'm advised that up to 26 will come on board very shortly. The first group of 11, it's planned to join the rollout on August the 16th, with an additional 15 later in the month, all things being well. The first group of pharmacies will be in Burnie, Devonport, Ulverston, Latrobe, Lagana, Riverside, Risdon Vale and Sorell. And that will be finalised later today, I understand. Other pharmacies have expressed interest, likely to commence in coming weeks, but the precise timing and locations will be determined with the Australian Government after consultation. Now, importantly, our safeguards only work if we use them together. Please remember to use the Tas Check-In app. Ensure that you use it when you buy your groceries, visit the gym or head to the cinema. When it's your turn to be vaccinated, please don't hesitate. Don't wait, vaccinate. Cover your coughs and sneezes, wash and sanitise your hands regularly, maintain appropriate social distancing, stay home if you're unwell and get tested, even if you have only mild symptoms. As was pointed out yesterday, and this has been discussed the last couple of weeks, make sure you have a COVID kit at home. Make sure you've got a mask, sanitisers, so that we're all well prepared and ready. Tasmanians have throughout this have worked very well together to ensure that we keep on top of this. Let's keep doing that. Importantly, we need to keep on top of COVID together. Now I'll hand over to Dr Veitch for an update. He'll take questions and then Kath will provide a vaccination update and I'll return for broader questions.
Thank you, Premier. So as the Premier said, the contact tracing process, which has been underway since yesterday morning, has been going well. I said yesterday that there would probably be in the range of 200 people who we regard as contacts of one form or another of this case. Numbers are probably a little lower than that. They're probably somewhere between 160 and 200. The calls to the people who came in on the flights, the VA 1364 flight from Melbourne to Launceston on Monday, are well underway. There's a small number of people in that group, I think around 20, who we were embarking upon further calls this morning. Sometimes it's difficult to catch up with people on flights because you've been given the wrong number or they're out of contact range. So we're working with colleagues and other agencies to see if we can identify where those remaining people are. But my message is, if you are if you were on VA 1364 from Melbourne to Launceston on Monday and haven't yet been contacted directly by phone by Public Health, please call the Public Health hotline on 1800 671 738. All those people have been sent SMS messages and emails, but if you're someone who for some reason we haven't been able to get in touch with, please give us a call. We're of course continuing to reach out to those people. And as the Premier said, the primary contacts between the border and the transport processes and the hotels are all being contacted, having their tests arranged at an appropriate time after they may have been in contact with the case, and if necessary required to quarantine. The good news is that the people who are on the same floor as this gentleman have all had a test and have tested negative, but they remain in quarantine until some further testing. So I might just leave it there. Happy to take any questions.
Dr. Veitch, what's your message to people who are feeling a bit panicked or uneasy about this positive case?
I can understand how people in Tasmania might feel uneasy. It really is unsettling, and to some extent we have been fortunate to not have to face the challenges that other jurisdictions have faced with trying lockdowns. What we're doing now is substantially precautionary. We have confidence in the way in which our quarantine process and border arrivals process manages this man. We of course were concerned that the people who are on that air flight back on Monday were not part of the quarantine process. That's why we're actively getting in touch with those people and making sure none of them have been cases. But I think the public can be reassured that all of the contact tracing processes are going well. But we are going to wait. We're all going to be a little bit anxious for the next 2 or 3 days until we start to accrue information that there aren't any cases amongst the people that this person has moved amongst. That's going to take, in the long run, up to about 14 days. But we'll have a pretty good idea after about 5 or 6 days, if we get negative tests all the way through, that the risk in the community is low. But we have to realise this is just an example of what can happen, and it can be quite difficult to predict, as I've said a couple of times, where a risk is going to come to Tasmania. So we have to be vigilant. We have to understand, we have to remain alert for the possibility of this happening. We have to have our COVID safety kit and make sure we clean our hands, wash our hands, use our check-in Tas app, do what we can to social distance in circumstances where that's possible. The other thing that's occurring over the next short while is I put in place a requirement for people in hospitals and aged care and day surgery centres to be wearing masks for the time being. That's because they're high-risk settings, and a number of events that will be occurring over the coming days, larger events, typically events over around 1,000 people, we're working with the organisers of those events to have people attending those events wear masks. So there's a few measures that Tasmanians aren't used to. If you're asked to wear a mask, please wear a mask. Don't regard it as a sign you're about to catch COVID, but just take it on board as a routine part of living with COVID risk. So we want people to adapt to these challenges and not panic. Long answer, but I think it's a very important question for Tasmanians to understand. We're doing all we can to protect them, and they can do their bit too.
How do you assess the response of Scotch Oakburn College to that close contact at their school?
The circumstances at Scotch Oakburn College was that a person associated with that school was identified as a contact. They were required to quarantine, which they did. The people who were in contact with that contact, who we call secondary close contacts, were all also quarantined for a short time. When the test result of that primary close contact came back negative, all the other people could be released because they weren't at risk from the primary contact. However, the primary contact has to remain in quarantine until their 14 days are up. So it was exactly as we expected an organisation to cooperate with our contact tracing team.
There are new rules for people who come to Tasmania without a valid pass. The Premier said yesterday they won't go to hotel quarantine, they'll just be put on the next flight back. If the next flight back to where they've come from isn't until the next day, what's going to be done with those people? What plans being put in place? Are they just going to have to sit in an airport departure lounge?
That's being worked through. As I think I mentioned yesterday, there's both a legal element to getting that process established and robust. That's being managed under the Emergency Management Act. Public Health will also provide advice into what safe management of someone for the short term, if they can have a flight and a short turnaround, will be, and how they would be managed if they need to have a layover here. Of course, we've learned from our experience in the last day or so, and I think that the processes that we had in place up until now have been reasonable, but I think this is an example of how Delta can catch you out, and we will have processes in place to make sure that people arriving without a valid pass are managed safely in a Delta environment.
And based on those changes that have been made, if someone arrives with a valid pass but still has to go into hotel quarantine, is there going to be, I suppose, would they still be allowed to potentially leave the state before a test result comes back, or would you prefer that if someone arrives and is tested, they have to stay until the result is received?
We're working through those conditions. Of course, we want to make sure that they're not allowed to leave if they pose any risk in the course of leaving Tasmania. So yes, we'll attend to those things, but I can't give you the details. But Public Health will work with our colleagues in Tas Police to work through that.
Can I just clarify? So you mentioned that you're still trying to get, or the contact tracing team is still trying to get in contact with 20 or so people. Did you say that some of them may have provided like false mobile numbers? Is that?
No, not at all. When you get a list of 100 people with phone numbers and email addresses, transcription errors, any number of reasons people's number can be wrong. And we, as I said, we've sent out mobile messages, we've sent out messages through email. Sometimes these people are out of range of mobiles or email. So we typically get our colleagues in the police service who are kind of good at identifying where people might be if you're trying to track them down, to give us some support on how we get in touch with these people. We've done this quite a few times during the course of the pandemic when we've needed to get onto someone and we haven't had information that enables us to do it. We can generally reach them.
You explained yesterday that when the man left the state, it was along an approved corridor and there were mitigation measures in place. I suppose a lot of people have contacted the ABC wondering how he was sort of able to just be put in a taxi and sent to the airport. What kind of measures would have been in place at the hotel and in the transport and so on to make sure that he wasn't, I suppose, having contact with people?
There's a process where people who are in the hotel and are discharged from the hotel, usually at the end of their time in quarantine, but if it happens to occur earlier on, There's kind of a red zone that people move through where there's required to be adherence to infection control strategies. Only certain people are allowed to be in that setting. And that's how we're able to narrow down the people we need to talk to by way of contact tracing. When someone leaves the hotels, typically in the past we have enabled them to leave in a taxi with a mask in the back seat, providing they're well. And the risk in that situation historically has actually been quite low. Many people have been in quarantine. We've had, I think, apart from the international arrivals and 2 people who came back from high-risk settings in Victoria last year, we've had no one develop COVID in quarantine. So our experience of people in quarantine developing COVID has been that we haven't had cases. And that would suggest that the process of putting people with measures in place in a taxi to leave the state has been safe. But I think this demonstrates the risk is higher with Delta, and that's why we're going to put more stringent methods in place.
Yeah, can we just be absolutely clear? Has anyone screwed up? Is that why this has happened?
Look, I just think that there's a lot of... We're not going to get out of COVID by trying to pin blame on individuals. We have to approach it as a complex problem which requires a system-wide approach, trust in people, being willing to fix things when we find shortcomings. That's what we're doing.
Catherine Moldwicks.
Thank you, Dr. Veitch. This afternoon I'll provide the latest information on testing numbers in Tasmania. We have in place surge capacity for our testing clinics, particularly at the Wellington Street Clinic in Launceston. In the last 24 hours to 9 a.m. today, 1,643 COVID tests were carried out across the state and 1,781 were carried out in the previous 24 hours. So it's fair to say that it's been quite a record in terms of the last 48 hours in testing in Tasmania. Today we have already had 1,189 appointments for testing, so that was as at 12 p.m. across Tasmania. This includes 617 in the south and 199 at the Wellington Street Clinic and 67 at our Prospect mobile testing clinic, which has been put in place. We also have 137 appointments in our Hobart and Launceston clinics already booked for tomorrow. Now, there are currently 426 appointments available in Hobart today, over 200 in Wellington Street in Launceston and around 85 at the Prospect Mobile Clinic. And we have our Hobart and Launceston testing clinics open until 9 p.m. tonight and 9 p.m. Saturday night. And the Prospect Mobile Clinic will be open until 5 p.m. today and tomorrow, and we'll continue to assess the opening hours for these mobile testing clinics and fixed clinics as we proceed through the weekend. And we will update those clinic opening times also on social media and in the media release that we'll issue each day. If I can turn now to PPE, and as the Premier has said, the health, safety and well-being of our healthcare workers and patients is a government priority, and we are well positioned with our supply of PPE statewide. This equipment includes masks, gowns, goggles and gloves and is essential for healthcare workers to protect themselves, their patients and prevent disease transmission in the healthcare setting. We remain in regular contact with our suppliers and continue to monitor the situation nationally and internationally regarding PPE supply and any changes to national recommendations on PPE use. And as at the 2nd of August, the Department of Health held the following PPE in stockpile and as stock on hand. So for surgical masks, 5.9 million, respirators, 3.7 million, so that's the N95 respirator masks, hand sanitizer over 55,000 litres, gowns 2 million, gloves 21 million, eye protection and goggles 1.2 million and face shields 123,500. And as of today we have 273 ventilators in the state. Turning now to vaccination, as the Premier has said, our vaccination program continues to gather pace. The vaccination program's finishing week 24 very strongly. As at 6th of August, we have delivered more than 337,499 doses across Tasmania, which is made up of 171,996 doses in state government clinics, 19,724 by the Australian government provider in aged and disability care, and 145,779 doses by general practice. In terms of a breakdown, in age, 83% of people aged 70 years and over have received a first dose, and over 51% have been fully vaccinated. For people aged 50 years and over 71% have received a first dose, and almost 35% have received a second dose. In terms of breakdown on what is happening in the regional areas of Tasmania, first and second dose coverage continues to be lower in the northwest, with 44% now having had a first dose than the state average of 50%. And we'll be monitoring this data in the coming weeks to ensure that the current and planned state-run clinics increase coverage in these areas. We currently have community clinics in Devonport, Burnie and Ulverstone, and are confident that these vaccination coverage rates in the northwest will start to lift. In terms of our community clinics, this week we opened our new clinic in South Launceston, which has been running very smoothly. This clinic and our Launceston General Hospital Clinic both have appointments available in August. If you are in the Launceston area and are eligible, please book now for your vaccination. Our clinics in Devonport, Ulverstone and Burnie all have appointments over the next 4 to 5 weeks into September, so again, don't wait, secure your booking now. In the south, our Hobart CBD clinic, as well as the Royal Hobart Hospital Clinic and Wellington Clinic, all have appointments available for the next month, so again, please get in and get your booking if you are eligible. In terms of eligibility, as the Premier said, from Monday we will be accepting bookings from our 12 to 15-year-olds with underlying medical conditions, so including those who are immunocompromised or who have asthma, diabetes or epilepsy as an example. So those 12 to 15-year-olds who are Aboriginal and Torres Strait Islander or who live in remote communities. Children who have an appointment must attend with their parent or guardian so that we can get the right consent in place before the vaccine is administered. Children will be able to access a Pfizer vaccine in our state-run community clinics and at participating GPs. The rollout to pharmacies, which is an Australian government responsibility, continues to be progressed. We are aware that up to 26 pharmacies will come on board in August, and we've been advised that the first group of 11 will join the rollout on the 16th of August. And the remaining pharmacies who have expressed interest in the program, and there is up to 105 pharmacies in Tasmania that have expressed interest, are likely to commence during September and October, but the precise timing and locations will be determined by the Australian Government after consultation with the Tasmanian Government. The first group of pharmacies to be onboarded by the Australian Government are located in Burnie, Devonport, Ulverstone, Latrobe, Lagana, Riverside, Riston Vale and Sorell. And second doses continue to be delivered right across our community clinics. Again, I reinforce the importance of ensuring that those of you that have a second dose to please turn up to receive that second dose and receive maximum protection. Our priority group of aged care workers continues to be a focus ahead of the mandatory deadline in mid-September for having a first dose. Data from the Commonwealth self-reporting tool for residential aged care facilities is showing that of the 8,000 aged care workers in Tasmania, we have fully vaccinated around 50% based on the Commonwealth self-reporting data. From our own reach into these residential aged care facilities, we are tracking at around 70%, noting that we do have a workforce that changes across these facilities every single day, but we continue to work with those facilities. So if you or someone that you know is an aged care worker, please get yourself a vaccination now. There are appointments that are available this month in August for you, so please contact us and we'll make sure that you get your booking. So finally, to sum up on eligibility for vaccination, 60 years and over, to get an appointment for a first dose, please contact a participating GP or GP respiratory clinic for an AstraZeneca vaccine. For 30 to 59 years, you can access a Pfizer vaccine in our community clinics. For 16 to 29 years, if you have an underlying medical condition, living with a disability or mental illness, you are eligible. And for our 12 to 15 years, if you have an underlying medical condition, if you are Aboriginal or Torres Strait Islander or live in a remote area, you are eligible for vaccination. So please do book your appointment now, and you can do that by ringing the Public Health Hotline or by booking online. So open for questions.
Have there been any challenges to introducing the new rules around mask wearing and visitor limits in aged care facilities and hospitals?
So we have reached out to each of our residential aged care facilities, and in fact our Aged Care Emergency Operations Centre does that on a regular basis, and we've also confirmed overnight that they have good stocks of PPE, so as a backup to people turning up and the mask requirement. They also have good screening processes which are in place, and we're there to support them if there's any concerns.
Is there any possibility we could combine the COVID testing and vaccination stations to get both done at once?
That's a very good question, and certainly one that has come up before, but certainly there's probably two different groups of people that we are dealing with here. If you are symptomatic and requiring a test, we don't want to increase that and introduce that risk into our vaccination hub environment, noting that on the mainland we have had instances where a vaccination hub has had to be listed as an exposure site due to a symptomatic person who's then tested positive to COVID and has gone for their vaccine. So we really are trying to keep those things separate, noting if you are symptomatic, your main aim is to book that test and to isolate until you receive that test.
So could we have the vaccinations put in the testing centres, have them park outside their waiting time, do it that way instead of vice versa?
So again, it's about making sure that we are actually protecting the staff that are involved in the vaccination clinics. They certainly do wear PPE, but not to the level that we actually have in our testing clinics, for example, which is full face shield, N95 or respirator masks, gowns, gloves, goggles, etc. So we really are keeping those separate and making sure that people know if they're symptomatic, book for a test. If you're symptomatic, you can also move your vaccination appointment if you have one on that day or following.
Questions of the Premier?
Thanks, Kath.
Premier, you mentioned yesterday that one of the reasons you're making a change to what happens to people who come to the state when they shouldn't is that hotel quarantine is almost at capacity. How many people are actually in hotel quarantine in Tasmania now?
I can provide you with that exact number. Currently in hotel quarantine, we have 330 people, and we have 630 in at-home quarantine. I might just on one other matter, just in terms of a question that you put to Dr. Veitch regarding the circumstances surrounding this individual. Under normal circumstances, this individual would have been turned around and sent home immediately. There were no flights, direct flights available to Sydney for 2 days, which is why he was placed into our hotel quarantine. Now, in terms of the direction, and obviously it's not ideal, the circumstances whereby he was able to have a test and then leave before receiving the outcome of that particular test. And we will sort that, and that will be fixed. But you set rules for reasonable people. In the same way that we've got rules in terms of check-in and social distancing, it beggars belief that this individual would enter our quarantine facility, be tested, and then take that opportunity to leave. But in future, that will not be able to occur.
And are you able to give us any details of why he was coming here?
No, look, I'm not. And again, we have had instances in the past where we have had individuals do this, and if there is a flight available, they'll be held at the airport and they'll be placed on that flight. It'd be fair to say, at the moment we have 20 people from the Spirit last night that have chosen to return back to Victoria, and they'll be placed on the sailing tonight, and they're currently being held in one of our hotel facilities for the afternoon, and then we'll return back to Victoria. So in terms of the border circumstance, it worked in this case. And in fact, now what we're doing, we just need to check these corridors in terms of the interactions that he had. But as Dr. Veitch has said, the mitigation measures are in place, and I'm hopeful that we won't see any further cases, obviously. we'll have increased testing today and we'll know in coming days.
Should he have been stopped at the border before getting on the flight? Should it have been a bit like the Spirit of Tasmania process?
Well, in terms of those people got on the Spirit. Obviously, last night the sailing was about the time that they would have been queuing at about the time we were doing this press conference. But what we have done, and I believe that we're the only state to do this, we actually have a biosecurity officer that is in the major airports, certainly in Tullamarine, and they provide information to people that are flying to Tasmania in terms of the requirements when they get here. You know, whether individuals listen to that or not is a matter for the individuals, and as I said yesterday, we have no lawful standing outside of the border of Tasmania. We can't ask to see somebody's pass, we can't force them not to get on a plane in Victoria. We don't have the lawful ability to do that. But what we have done is taken steps further than, as I say, I believe any other state. I've never seen someone from Victoria or Queensland here at Hobart International Airport assisting people that are looking to fly to Queensland to let them know that there are border restrictions in place, and certainly the attempts or efforts that we've made to stop people from coming in the first place. We tried to do that offshore, and when they arrive here under normal circumstances without a valid pass, they're held at the airport and placed on the next available flight. For obvious reasons, Sydney and New South Wales is obviously at the highest level of risk and in terms of the restrictions, and therefore flights have been limited, which is why there wasn't a direct flight available for this individual immediately.
To your knowledge, this person wasn't told by people at the hotel that they should leave?
To my knowledge, no.
They
No.
made their own choices.
They made their own choice.
Just on hotel quarantine again, as you mentioned, we're reaching capacity because of obviously people coming, potentially Tasmanians returning from the other states as they have their COVID crises. Is there still room, or is there any impediment to us continuing to quarantine seasonal workers for Victoria?
We're looking at that at the moment. Over the next, I think it's 40 days, we have 3 flights coming in, and so we're basically bumped together. We're having a look at that. We began discussions last week with other hotel facilities as well to see whether or not we can pick up some additional space. But look, what's really interesting about this is that we've actually got people that are fleeing New South Wales that have leased properties here in Tasmania so that they have a valid Tasmanian address. They have work to go to in many cases, and they're actually fleeing and utilising and quite happy to pay the quarantine fee. That's what's putting pressure on our hotel system.
Right, back to the point about the borders and the good to go pass. Do you think authorities interstate should maybe do a better job with people looking to travel between places that might have issues around their borders and that?
Well, look, I'm not going to be critical of interstate practices, but again, I made the point yesterday. There is a possibility, and again, it'll be up to the New South Wales authorities to make a decision on this. But it would appear at face value that this individual has actually breached the stay-at-home order that was in place in New South Wales, and so you've got an individual that's prepared to run the gauntlet. Importantly, our system stopped him here. He never got into the Tasmanian community. He was placed into hotel quarantine. And as I've said, under normal circumstances, had there been an available flight that day, would have been turned around at the airport and sent home.
Right, just on the cancellation of the AFL game, do you sympathise with hotels and businesses that have lost income from what was supposed to happen this weekend with the big crowd? And just furthermore, do you expect the Hawks Bulldogs game to go ahead next week, or is that very unlikely to go ahead?
Well, I'll work backwards. Hawks Bulldogs, we're obviously working through that, and we'll take public health advice on that. Victoria have put in a 7-day lockdown, and one would hope that their numbers over coming days would improve. Whether that occurs or not, and whether or not we've got the confidence to reopen our border to Victoria before next weekend is another matter. I would make the point, though, that we have had a team come into the state previously, North Melbourne I think it was, with the Gold Coast game, that came out of Victoria when it was in a lockdown situation, but the players were in a sterile bubble. And again, we'll need to look at what's occurring with both Hawthorn and the Bulldogs teams before we make a final decision on next weekend's game. I've spoken to Jeff Kennett, in fact, in the last hour. He asked exactly that same question, and I've provided him with the same information. But we'll continue to work through that. Now, obviously, there are a lot of businesses that will be disappointed. One of the key reasons that we were keen to have AFL on in the state at the moment is that with New South Wales shut and Victoria that's been basically turning on and off like a light switch in terms of lockdowns, it was important to ensure that we could attract people from across the state to fill beds around those the grounds when the games are being played. So I can understand their disappointment. And believe me, my wife's a Collingwood supporter. I'm feeling it very close to home as well.
Do we know if this close contact who's, I think it's tested negative now, at Scotch Oakburn, were they a student or a teacher?
Again, look, I'm not going to go into the detail of it. I believe Scotch Oakburn have put out a statement recently, and I'd refer you to that.
Deputy Commissioner Adams yesterday said that a referral had been made to New South Wales Police about the man and whether he might have broken any New South Wales laws by coming here. Have you had any update on that?
Look, I haven't as yet, and obviously that's a matter for the New South Wales authorities to work their way through.
And just checking, this morning the Best Western Hotel had a fire alarm which required the evacuation of people, including some of the seasonal workers who were quarantining there. Were there measures, or would there be measures in place to stop them from, I suppose, getting close basically to people in the community who aren't in quarantine when that sort of thing happens?
Look, my understanding is that all measures are put in place in terms of those situations. Look, it's not uncommon. We've had it happen before. Well, so it's not uncommon. It has happened before. It's not a common event, but we've certainly had fire alarms before in these hotels, and people are appropriately managed at the time.
Given that there haven't been any positive tests so far, do you have any intention or expectation that you'd be imposing any more restrictions, I suppose, or any more rules for the community in the north over the weekend, or is it remaining as it is?
Look, I'd obviously take public health advice on those matters, but at this stage, obviously, the first thing that we need to do is to conduct the testing to get the results, and obviously people have turned up in droves yesterday and the day before, and I expect that that'll occur today as well. And so once we've got those tests run, that'll provide us with a clear indication as to whether or not there are any positive cases that we need to be concerned about, and then obviously there would be measures that would be taken then.
So at the moment, regular community sport and so on will continue?
That's right. The Director of Public Health did mention yesterday that we're looking at large events and giving some consideration to that and what it might look like moving forward, but that's more in the context of this very challenging Delta situation in terms of how we manage events moving forward. As we had already put in place steps for the football, people wearing masks last weekend and this weekend, and we're looking at other large events as well.
I mean, just on the Carter report, can you give an update on what your knowledge of that is at the moment?
Look, I had a conversation with Gil McLachlan last night. In fact, I had a couple of conversations with Gil yesterday on a range of matters. I expect to receive the Carter report before the middle of next week. I expect that the AFL presidents will also receive a copy of it then. At this stage, I can only speculate as to what's in it. I haven't been provided with a briefing. But I have made it clear to Mr McLachlan, as I've said the same thing to Jeff Kennett this morning. Until I've seen that report and understand the direction that it sets and lays out, we're not in a position to roll over those contracts with Hawthorn and North Melbourne, and so hopefully we'll have some clarity next week.
I mean, just one last question on the man himself. So the police interviewed him as to why he was here. As you said before, you can't give details. Has he been interviewed? Has he been questioned about why he actually was here?
Well, he was obviously questioned by our Border Security staff, and they made the decision to place him in quarantine. And if there had been a flight, they would have sent him home.
So he didn't have a valid reason.
You need to have a valid reason that can meet the exemption requirements to enter the state if you're coming out of a high-risk area, and obviously that wasn't in place. That's why he was placed in quarantine.
The latest round of Tasmania's travel voucher scheme has just opened. Do we have any numbers yet on how many Tasmanians have logged on and applied?
108,000.
What are the large events that you mentioned might be subject to different restrictions? Can you give us some examples of what they are?
Look, we're working through that at the moment, but obviously an event that would attract a larger crowd, but again this is a matter for the Director of Public Health to work through, and again looking at this through the lens of Delta.
Thanks, guys.